The long-awaited moment is finally here. Why am I saying this? So a couple of weeks ago, I did a video on the UK government announcement that was made about adding healthcare assistants, care workers and home care workers to the shortage occupation list. So what this means is employers within the UK are able to issue certificates of sponsorship to anybody who has this qualification so that they will be able to apply for health and care worker visa in order to come to the UK and work. This is how simple it is. And when they made the announcement, they were not really sure when it's going to take effect. So I did a video on that. If you've not watched it, I'll leave the link up here and also in the description box so that I can have a look. And I promise to bring an update whenever I hear anything. So this video is going to be about the update on this new health and care visa that is going to be launched. So in this video, I'm going to cover when it's going to take effect, the benefits of applying for this kind of health and care visa, how long it's going to take, and also stay tuned to the end because I'm going to share with you some tips so that the moment this visa is launched, you can take advantage of it. Hello everyone, you're welcome to my channel. This is a channel for nurses and care workers who wish to migrate to the UK. I also do videos on basic life in UK in general. So if this is something you're interested in, please stay tuned, join the family. And to all my returning subscribers, thank you so much for always stopping by. My name is Diana and you're welcome. Share this video when you find it useful with others so that they would also benefit. So in order for you to be able to work in the UK, or in order for you to qualify to apply for a work visa to come to the UK, you should be in a profession which is in the shortage occupation list. So previously they had nurses, doctors, teachers. There is a whole long list of professions on the shortage occupation list. So they keep on updating the list. So last year the UK government announced that they're going to add care workers, home care workers and healthcare assistants to the occupation shortage list. So we're going to cover the update on this announcement. So let's talk about when it's going to be launched and how long it's going to be in place. So you don't need to waste time at all with this because it's only going to be in effect from 15 February 2022 up until 14 February 2023. So that means it's only going to be in place for just 12 months. And afterwards, the UK government will review this and see if they would want to extend it. But personally, I think they might extend it further because they launched this type of visa that would enable agricultural workers to work in the UK. The plan was for them to do it as a pilot program, but it's still been in place for almost 3 years now. So with looking at the kind of pressures the healthcare industry is facing in the UK, I personally believe it might be extended further. However, you should take advantage as soon as it's launched so that you can send in your applications, contact nursing homes and contact agencies to send in your application as soon as it's launched so that you don't miss out on it. So from 15 February 2022, overseas social care workers, care assistants and home care workers will be eligible to enter the UK on health and care worker visa. This will alleviate the current stresses within the social care sector and allow additional workers to be able to recruit it to fill staff shortages. Talk about the eligibility or who actually qualifies. So if you're a home care worker, if you have an enrolled nurse certificate back home, or if you're a healthcare assistant, you do qualify to apply for this. So they didn't really mention exactly what type of qualification they would want in order for you to apply for this kind of visa. What they said was a qualification of RQF level 3, which is equivalent to the skill of somebody who has A-level certificate. So meaning if you are enrolled nurse, if you're a healthcare assistant, I believe your qualification is even way above this A-level that they're talking about. And so because they didn't really state the type of qualification they're looking for, what you will need to do now is to get the skills and the experience. Talk about some of the documents that you will need in order to be able to apply for this health and care visa as soon as it's launched. So documentation wise, you need a tuberculosis test. You know, looking at this pandemic and all that, tuberculosis test is something that you would definitely need, and it's something you need for any type of visa to be able to come here. So they always have approved centers in every country, so you just have to find out from the country you'll be applying for where the approved center is so that you can go and do that tuberculosis test. You also need a police clearance. So in any country that you've lived for more than 12 months, you will need a police clearance. So if, for instance, you live in Nigeria and you've ever traveled to another country where you live there for more than 12 months, you need a police clearance from Nigeria as well as that country where you live for more than 12 months. And English language proficiency is something I can't really stress enough, because UK is an English speaking country, and for any type of visa to come to the UK, you will need that English proficiency test, especially if you're coming to work, if you're coming to study, you will definitely need that. So I would advise that you start preparing by taking some lessons and reading online to prepare yourself for the English exams, which is the IELTS. You can write that ahead of time so that once it's launched, or if you get an employer and they ask you for your English language proficiency, at least you know you've got your IELTS already. And another important document that you would need, without that document, irrespective of any other document, you cannot come. That is the certificate of sponsorship. So the certificate of sponsorship is what the employer would issue you once they've given you the job offer. So that certificate of sponsorship, which is normally called the COS, will state the type of job you're coming to do, the contracted number of hours you're going to do in a week, how much they're going to pay you, and everything. So it's very, very important. Another good thing with the COS is that if you are issued with the COS, you will not need to add a bank statement to your documents needed to apply for the visa. When I was coming to the UK, I didn't really need, because if I had been asked for a bank statement, I don't think I would have had that much money in my account as proof of funds. So if you have that COS, it's really, really good. So one good thing about this is the cost of the health and care visa. So there is a 50% reduction in the application fee. This means if your employer gives you a certificate of sponsorship for 3 years, which is normally the minimum, then you would have to pay a visa fee of 232. But if your employer issues you with a COS or certificate of sponsorship for more than 3 years, then you have to pay 464. But normally employers do issue the COS for at least 3 years, and then you can extend it once you get here. So let's talk about the required salary threshold for this type of health and care visa. So according to the government guidelines, the employer who is issuing you the job should be able to offer you at least a salary of £20,480 per annum, or at least £10, 10 pence per hour. That is the salary requirement. So if you get any job offer from any employer and they are offering you anything less than that, then you should really question that, because if you get that COS from the employer with a salary less than what the government has stated, you will not be issued the health and care visa for you to come to the UK. So once you get any job offer from any care home, nursing home, any agency, read through it properly and make sure the salary threshold they've stated is in accordance with the government guidelines. There are so many benefits with this type of visa. So once you apply for this visa, you do not only come as an individual, but your dependents. And when in UK, when they talk about dependents, it's your husband, your spouse, your children, or any child that you've legally adopted. They are your dependents, and they also qualify to come with you. So you do not only come as an individual, but your dependents are also coming with you, which is very, very good. So another great thing about this health and care visa is you are able to apply for permanent UK residency after 5 years, which is called the indefinite leave to remain. So normally they would issue you with a visa of 3 years, and once you come in, you're able to extend it further to 2 years, making it 5 years. So after the 5 years, then you qualify to apply for settlement here in the UK. And it will not only be for you, the applicants, but your dependents will also qualify for the settlement as well. And another good thing is after the settlement, in the 6th year, you qualify to apply for UK citizenship. So this is really, really, really good. Another good thing is you will not be required to pay for the IHS, which is the Immigration Health Surcharge. So this IHS is like an additional fee that initially you would have paid on top of the visa fee, but with this type of health and care visa, the government has scraped off that immigration health surcharge. So all you need to pay will be the application fee as you go in to make your application. And also because UK is in a shortage of healthcare workers and they really do need more people, there is like a faster processing for this type of visa. Once you go in to submit your application to do your biometric, at least within 3 weeks they try to process it so that you can get your visa. So I don't want this video to be too long, but before I end, I would like to give you one tip. So in order for you to take advantage of this opportunity, do not just apply to one job and then sit down. you have to keep on applying. You have to keep on contacting employers. You have to keep on contacting care homes. Even if you have to buy airtime and then call, please do. Doing my best by giving all the information out there so that you can also make the effort to contact agencies, contact employers as much as you can to increase your chances of getting a slot. Also, try and update your CV. So if you don't have an updated CV, try and then update your CV with all the skills and all the qualifications that you have, which is relevant to the healthcare worker visa or relevant to the healthcare assistant job description. And lastly, even if you don't have any form of healthcare experience, because luckily they didn't really state that they need a particular type of qualification, you can as well try and then do some internship or like get some form of experience in a hospital, at least just to get the basic experience. Because definitely if an employer wants to give you a job, they will interview you, and what will make them know that you have the skills is what you portray during your interview. So if you don't have the basic skills, it will be difficult for you to pass the interview. I did a video on the sample questions and answers for healthcare worker or healthcare assistant and senior carer. So I will leave the link in the description or leave the link up here so that you can check and then start preparing yourself for this as well. So if this video has been of benefit to you at all, please do me a favor by subscribing to this channel, share with others so that everybody will also benefit. So because of this update, most employers are going to start applying for license to be able to issue overseas workers the certificate of sponsorship. So I'm going to do an updated video on the agencies that are currently recruiting. I did a video on agencies who are recruiting senior carers, and because of this announcement, I've done an updated video which I'm going to release very soon. So keep an eye for that video so that you can contact any of these agencies and apply as soon as possible. See you in another video. Bye.